Merin's classification. Merin classification is recall interval for various classes of recall patients. The first year after periodontal therapy is important in terms of training the patient in a recall pattern and reinforcing oral hygiene technique. In addition, it may take several months to accurately evaluate the result of some periodontal surgical procedures. So some area may have to be retreated because the result may not be optimal. Further, the first year patient often have etiological factor that may have been overlooked that may be more amenable to treatment in the early stages. For these reasons, the recall interval for the first year patient should not be longer than 3 months. There are several categories of maintenance patient and suggested recall interval for each. Patient can improve or relapse to a different classification with reduction in or exacerbation of periodontal disease. So, the maintenance care is a critical phase of the therapy. The long term preservation of dentition is closely associated with the frequency and the quality of recall maintenance. So, we will be recalling the patient after evaluation of first year maintenance phase. So, in first year patient routine therapy and uneventful healing. If patient is having uneventful healing, we'll recall the patient after 3 months. And in first year patient, if we have observed some difficult case with complicated prosthesis, furcation involvement, poor crown to root ratio, or questionable patient cooperation, then we'll recall the patient in 1 to 2 months interval. And further, on the basis of that, we'll classify the patient as class A, class B, and class C. In class A patient, the recall interval will be 6 months to 1 year, because the patient will be having excellent result, well maintained for 1 year or more. Patient displays good oral hygiene, minimum calculus, no occlusal problem, no complicated prosthesis, no remaining pocket, and no teeth with less than 50% of alveolar bone remaining. In class B, the recall interval will be 3 to 4 months, and the patient will be having generally good results, maintained reasonably well for 1 year or more, but patient displays some of the following factors like inconsistent or poor oral hygiene, heavy calculus formation, systemic disease that predispose to periodontal breakdown. Some remaining pockets might be there, occlusal problems, complicated prosthesis, ongoing orthodontic therapy, recurrent dental caries, some teeth with less than 50% of alveolar bone support, or smoking, or maybe some positive family history or some genetic test may be positive for that patient. Then we'll recall the patient after 3 to 4 months. And in class C, generally poor result after periodontal therapy or several negative factors from the following list. Inconsistent or poor oral hygiene, heavy calculus formation might be there, systemic disease that predispose to periodontal breakdown, or many remaining pockets might be there, occlusal problem, complicated prosthesis, recurrent dental caries, periodontal surgery, indicating but not performed for medical, psychological, or financial reasons. Many teeth with less than 50% of alveolar bone support, condition too far advanced to be improved by periodontal surgeries, smoking, and positive family history or genetic test. More than 20% of the pocket bleeds on probing. So these patients will be called after the interval of 1 to 3 months. And this classification was proposed by Merin. Thank you so much.